So today we're doing a demo of dry needling for low back pain and mid back pain. Also, we're going to do one muscle that is involved with sciatica pain. As we go along, Justin, our patient, will let us know how does he feel, if he feels any discomfort. Also get his feedback with if we are tackling the right areas of pain. Usually when we do the dry needling, the sensation of the needle is actually almost none until the needle starts to connect with the tight area of the muscle. And then usually the patient will start feeling some deep ache, which is similar to like a deep tissue massage, but just for a brief moment and a little bit more intense. However, as long as the needle stays in, there is no more pain, and it's all benefit of the release of the muscle tension and also the pain. And how do you feel right now?
Fine. Can't feel it at all right now.
Okay, good. So I'm proceeding with the next level in the lumbar spine. Again, I'm making this video for some of the potential patients who wants to try to get rid of their back pain or find a very effective way to manage it and afraid of needles. It's a simple procedure that is not as invasive as a lot of people think. And also when you imagine the needle, it's not something that you feel. When you're lying on the table and getting the treatment done, you don't feel all of what you're seeing. My patient, Justin, how do you feel so far?
Good.
Are you feeling pain right now?
No, not bad.
I'm moving on to piriformis, which is the most important muscle when it comes to sciatica. Usually this muscle is responsible for hip external rotation, and the sciatic nerve passes through that muscle. It's hard to release this muscle using other tools, for example, like a massage ball or just deep tissue massage, because this muscle lies, the piriformis lies below glute fat, and then the glute muscle, then the piriformis. Do you feel a little twitch there?
Yeah.
The insertion of the needle, sometimes when it hits an overlap in the muscle fibers. So these are the muscle fibers here. Okay, so when there is an overlap and the insertion of the needle goes through that, there's like a stretch reflex response or knee-jerk reaction. Same mechanism locally in the muscle, but again, it's associated with the relief of pain. All right. Can you tell us how did that feel?
It's similar in the sense of having pain go down your sciatic nerve, but it's not a burning sensation. It's more of like a muscle flexing on its own. So it's not painful, it's uncomfortable, and it's a funny feeling.
Okay. How long does this feeling last?
It's already gone.
Okay. Is this around where you feel it the most? Or a little more?
Up. Yeah.
Okay. Around there?
Yeah.
Also, one of the things that we use to trick the body from feeling the prick of the needle is to use this tube that applies pressure on the skin. So that what you feel is pressure, you don't feel the needle. So when you press with the tube, you feel pressure, then the needle goes through the tube without feeling the prick of the needle. Do you feel the prick of the needle?
Very rarely.
So I'm still working on the same muscle groups from the thoracic spine, the erector spinae, but also I'm going through a little bit of the lats latissimus dorsi.
That last one, not
This
the
one
one
is-
you're doing now, but the one before that, that is like, I would say, centralized to where all my pain is around that area.
And that's exactly what we want to see. We want to communicate with that muscle that creating the pain or has the tension, so we can release it through the insertion of the needle into the muscle in the overlap of the spasm, which is usually deeper to our reach manually. So if I hear like someone, you are feeling a little bit ache sensation, that's what we want to achieve. Like a deep muscle ache, then release.
I want to say after the treatment, it is sensitive area for maybe a day, day and a half, and then the pain relief it's worth every bit of it.
So you can feel some, usually you feel some soreness.
Soreness, it's like almost like you worked out a little bit or something.
Mm-hmm. For like 36 hours or so.
Yeah.
Mm-hmm.
I wouldn't say 36 is a little too long. I'd say usually that'd be at the longest, but like half a day.
Also, like in the beginning, the soreness effect is a little more for a little longer time. You feel that?
Area.
Uh-huh. I can feel some resistance, so here we go. We're gonna do last level. Now I have my setup done. This is a little advanced. We don't do it all the time. If the patient already feels that the muscle has been stimulated, the needles are engaging their pain, then we leave it as is, or sometimes we connect it to stimulation. But before I connect just into a stimulation, because I know him and we've been doing this treatment, we do manual stimulation. So what this does, it wraps the fascia around the needle, creating a stretch effect deep within the muscle. It enhances the effect of the needling when it comes to muscle tension and pain relief. Imagine you're looking at that spaghetti plate and you dip your fork in it and you start spinning it or winding it, and that's what you do. You get all the fibers more attached to the needle, creating more stretching in there, more attachment to the muscle, more relief. How did that feel?
A little bit of pins and needles, but other than that, not too bad.
For how long?
It's already done.
It's already done. So everything you feel with the needling is just a few seconds. So next we're doing the stimulation. So I'm stimulating each area separately. So I'm stimulating here the thoracic spine, lower part of the thoracic spine separately. Then we attach the lumbar spine, the lower back with different channels. That creates like the muscle facilitation around the needle. Back to the idea of the needling and how it releases the overlap in the muscle tension. Now we're gonna create the function of the muscle through this stimulation, having the muscle to pulse around the needle. So it increases the effect of the release within the trigger point. And also the electrical stimulation is associated with pain relief. So it creates pain relief through many mechanisms, The pain gate theory is one of them. Release of beta endorphins is one of them as well.
I'd also say it feels like it helps work out muscles that I can't work out anymore on my own.
So it also helps the patient to have a more increased neural connections between the muscle and the nerves, especially when there's some atrophy. So in that way, it's also good. So we're gonna start now the thoracic spine stimulation. So our patient, Justin, right now he's in charge. He's gonna tell me what intensity is good for him. So when it's a good level, and the good level is strong, but not uncomfortable. So let me know when it's good.
That's good.
It's good. Okay, now the piriformis, the upper glute area.
That's good.
Okay. Let me know if something is too strong or too weak. So usually we keep our patient under supervision while this treatment is going on, so we can adjust the stimulation. Usually patients overcome that from the first time, but also we're here for reassurance if something doesn't feel, right. Also, one of the questions that I get about needles are, how do you know that you're not gonna hit like a vital organ or anything? We don't just needle any point, like any part. We needle based on certain muscles that is always like there is some like a separation between the internal organs and the muscles by bone. So right here we have the spinal cord, and then we have all the vertebrae of the spinal cord are right below the muscles. So there is no way you're gonna penetrate all the way to the abdomen, or all the way to the lungs, or all the way to the bladder where the glutes are, because you have the pelvic bone, the iliac bone right here protecting it. So we go according certain points that we only can needle. We don't need any points. It's based on science of which muscles you can needle safely.